In this presentation, we're going to talk about some of the illnesses that involve inflammation that's kind of ongoing or that is the underlying cause of the illness or condition. Sinusitis is a key one, okay? So this is inflammation of the paranasal sinuses and the nasal cavity. Paranasal sinuses are these open spaces that are lined with the protective mucosa that has those little cilia, the hairs that are able to move things out. They also have pseudostratified columnar epithelial cells and some goblet cells, which are needed to create mucus to trap bacteria and organisms, and then the cilia can move them out. So there is lots of bacteria in the nasal cavity up in here, but up in the sinuses, those are supposed to be sterile. So in sinusitis, you can either have acute, subacute, or you can have reoccurring. So subacute sinusitis is an inflammation of the paranasal sinuses that lasts 4 to 8 weeks. Subacute, it's lasting a bit longer, 8 to 12, and recurrent is where the patient has up to 4 episodes of it every year, and they're having these sinus inflammation problems that completely resolve between episodes. So they have inflammation, the pain, the swelling, just awful, and then they have periods of time where there's nothing there. Chronic sinusitis is where they have this kind of persistent low-grade inflammation of that paranasal sinus that lasts more than 12 weeks with or without flares of acute sinusitis. So this can occur in people that have nasal polyps or if they don't have nasal polyps, and it can be due to triggering by allergens or fungal conditions. I myself, when I used to live in the Pacific Northwest, had severe sinusitis. I was allergic to pretty much everything that blooms out there in that beautiful part of the country. And as a result, when I was much younger, I would have these sinus infections. And most of the time they were recurrent sinus infections, but I do remember one time having chronic sinusitis and it lasted for several months and it was just so awful. You're in so much pain. You've just got this constant headache, like in here in your forehead. You have sinuses here, you have sinuses here, 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 and back here. And when they get swollen, it's painful. Not only that, but you're not taking in oxygen because your nasal cavities they alternate between really, really stuffy and then running like crazy, and you're not taking in oxygen, so you feel like you have anemia, just exhausted. And in fact, I ended up having to have surgery on my sinuses and have them remove a lot of the tissue that was just infected and scarred and all that from this inflammatory process gone amok. So what's happening in acute sinusitis? Well, the sinuses produce these secretions that are supposed to flow in one direction from the ostia, which is providing that outflow of drainage, and it's not supposed to have any backflow. That prevention of that backflow is important because it prevents contamination of the sterile sinuses. But if there's blockage of that outflow, usually because there's an allergy or a virus or an irritation of some sort, it causes the sinuses themselves to become inflamed. And again, remembering that the nasal cavity is not sterile, the impaired clearance of that mucus by those little hairs, the cilia, or if the mucus changes its quality or quantity, any of those things can cause sinusitis. One of the things that we see is patients with cystic fibrosis. Now you remember cystic fibrosis from Module 1. We talked about that. It's autosomal recessive trait where you inherit it from two parents that were carriers of it, right? And it impacts that CFTR gene that regulates sodium balance. So they end up having thick, sticky secretions even in their respiratory tract. So people that have cystic fibrosis, or if they have chronic respiratory allergies, they're all going to have a higher risk for sinusitis because they constantly have this inflammatory process happening in their nasal septum, their nasal cavity and paranasal cavity. And they also can have changes in the mucus formation or mucociliary clearance problems. People with cystic fibrosis, that is the issue. Too much thick, sticky mucus, and they can't get it to move out. So they end up with chronic sinusitis. Acute sinusitis, the underlying cause or etiology, viruses can do it. Many times we end up with a virus first, like a cold, rhinovirus, adenovirus, coronavirus, any of those, parainfluenza, but then you end up having that inflammatory process happening in the sinuses. Bacteria can also do it. So it can be bacterial sinusitis. Many times once we've had a pretty bad infection, we couldn't get everything out. The mucus secretion wasn't getting everything out and it kind of trapped some particles in there which allowed bacteria to grow, and so you end up first you had like a cold and then you end up with a bacterial sinusitis. There are other things, like I told you I was allergic to everything in the Pacific Northwest. I had respiratory allergies which caused this chronic inflammatory process to cause me to have sinusitis all the time. An injury to your face, dental infections, or even immunodeficiency or immunosuppression can cause acute sinusitis. Fungi can cause it, but it's really, really rare to get a fungus up in your sinus. So manifestations, that word means like the signs or symptoms, what you see in somebody. Congestion of the sinuses and the inflammation is going to cause the face, usually the face, to feel really, really painful wherever there's a sinus, particularly here or here. And it can be bad enough when these sinuses are involved that it causes what feels like tooth pain because it's impacting the nerves that serve your teeth, right? And this pain tends to increase with any kind of straining or bending down. So you bend over and it's like womp, 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 or you bear down to have a bowel movement, same kind of thing. It can be bad enough to cause fever because, again, it's an inflammatory process. And if it's an infection, with sinusitis, itis means inflammation. So if you end up with an infection, a sinus infection, that fever can get higher and higher. You're going to have nasal congestion, and it can alternate with excessive nasal discharge, which means like I would go from having a super stuffy nose to just everything pouring out, or having them happen at the same time. Postnasal drainage is where snot is basically dripping down off that little uvula that's in the back of your throat. When you're looking at somebody with this, you can see it. It like goes glop, glop. It's pretty disgusting. If I'm ever having it happen, I'll let y'all look at it, okay? Persistent cough, yeah. And fatigued, again, because they're not getting enough oxygen. So we diagnose this by tapping on their sinuses to elicit pain. We ask them about viruses, that kind of thing. We're going to look at that ESR, that is erythrocyte sedimentation rate, or the C-reactive protein, which again indicate to us that inflammation happened. And we can look at the white blood cell count. We can do x-rays to see if there's any areas where the mucus is really thick and filled, and that'll show up as white or opaque on the x-ray. Open air should look as black on an x-ray. So when you see white, not so great. Treating it, we eliminate whatever's causing the problem and we treat the symptoms. For example, when you put a nice hot moist cloth on somebody's sinuses, it really helps to decrease the inflammation and kind of drain the fluid out. If it's allergies, we give antihistamines, maybe decongestants. There's some nasal sprays that promote vasoconstriction to decrease the inflammation, like oxymetazoline hydrochloride. But here's the problem with that. There's a big, big chance of them getting rebound nasal congestion and swelling. So you constrict it and then it comes back even worse. So we want to make sure they don't use that for too terribly long. The pathophysiology of chronic sinusitis, which is also known as rhinosinusitis, usually there's like many different inflammatory diseases that are happening. So it can be an environmental factor like persistent infection or allergies, plus some sort of genetic factor like some sort of metabolic abnormality or immune deficiency. And these things are all kind of coming together to create the perfect storm that causes this problem with the little ciliary in the mucus being able to clear out the mucus, which is called mucociliary clearance, and that causes kind of a stagnation of that mucus, which is providing the best little breeding ground for bacteria to grow, and that's what causes the inflammation of the sinuses to be ongoing and chronic. There are some risk factors for chronic sinusitis, and those are going to be basically anything that increases that risk for poor oxygenation or flow of blood to the area. So nasal polyps are these little mushrooms that can form inside of the nasal passage. They can cause sinusitis. It can also be, like I said, an allergy, even a fungal disease. Any kind of anatomical abnormality of the osteomeatal complex, like a septal deviation, allergic rhinitis, aspirin sensitivity, asthma, the nasal polyps, non-allergic rhinitis, just like vasomotor rhinitis or from cocaine abuse, any kind of defect in the mucociliary clearance. Right here, you should be inserting cystic fibrosis and the lack of that CFTR gene that regulates that sodium, right? Hormonal things. So we do see sinusitis risk increase during things like puberty, pregnancy, or even contraceptive use because it's triggering more of a widespread inflammatory process. If you have a tumor obstructing somewhere, immunodeficiency where your body can't fight things off. Again, I mentioned cystic fibrosis, primary ciliary dyskinesia or Cardinger syndrome, Wegener granulomatosis, and repeated viral upper respiratory tract infections, smoking, environmental irritants, pollutants, or any kind of dental disease can all increase the risk of developing chronic sinusitis. What it's going to look like, again, is very similar to acutes, but it's going to have more of an insidious onset, meaning it's going to not just come out of nowhere like a viral and then a sinusitis redue to that, but it's going to be kind of slow and sneaky. Usually they're going to have nasal congestion, then postnasal discharge, the runny nose, sore throat. Their breath stinks really bad. They can have an unpleasant taste in their mouth. Usually they're going to have that low-grade fever that we see with any inflammatory process. Fatigue, anorexia, chronic cough, hyposmia, which is this reduced ability to smell, and that's due to everything being all congested. And they're going to feel that discomfort, that pain, that facial fullness in their face or in their head. And that the headache does tend to occur with nasal polyps. We diagnose it by asking all those questions for chronic. How long has it been lasting? And if they've had at least two of these symptoms, that anterior, posterior mucopurulent drainage, meaning that it's kind of a greeny, yellowy, frothy looking stuff, nasal obstruction, facial pain, pressure, fullness, trouble smelling. They can also be accompanied with presence of chronic inflammation resulting in at least one of these: purulent mucus or edema in the middle meatus or the ethmoid region, or polyps in the nasal cavity or the middle meatus. We can do a CT scan to confirm that diagnosis, because when the mucus area, the mucosal thickens, it changes the surrounding bones, kind of moves them out, or it changes the air and fluid levels that are seen. So we'll see different areas of opacity. And we treat it by trying to reduce mucosal swelling to promote the drainage and clear the infections. So usually it's going to be a combination of antibiotics, glucocorticoids, nasal saline irrigation, and they may have to go see a specialist like an otolaryngologist, which is an ear, nose, throat kind of person, and they might, like me, have to have sinus surgery. Okay, that's it for this presentation.